Okay, so thanks for coming. And real quick, before we get started, I just wanted to I'm going to start the timer, 20 minutes, and then just get your verbal confirmation that you consented for this to be recorded and viewed by the instructor.
Yes.
Okay. And before we kind of get going, I'm going to ask a handful of questions. But first, what do you feel like you did this past week that you are proud of, or something that you did well?
I think I am proud that I didn't yell at my daughter when I was frustrated.
That's wonderful. That's a huge thing, actually.
I wanted to. Yeah.
Yeah, feeling like you were in control of the emotions of wanting to, well, I shouldn't say explode, but yell, but you didn't. So that's really good. Yeah.
Yeah.
Awesome. Okay, so to start, how can I be helpful for you in this session so that hopefully by the end of the session you can say, oh, I'm glad that I volunteered to do this with Julia?
I think just help me with giving me tools of what I can do when I feel like I am reacting to like someone or a situation out of like a fear response. So like how can I work on not just reacting, so that I'm not saying something I don't mean or um you know
Mm-hmm.
and so that I also don't feel like I'm out of control, so
Mm-hmm.
that it helps my anxiety not go real high, because that happens when I feel like I'm responding from a place of fear, so
Yes, yes.
yeah, help that.
Okay. So it sounds like being, calmer is something important to you so that you can kind of regulate some of your reactions a little bit better.
Well, I don't know if calmer is actually, because I can't really help when I mean, I love to, yes, but
Yeah.
I feel like I can't really initially be calm, so I guess it's more like recognizing when I am in this like reactive place of from coming from fear, that like, oh,
Mhm.
I'm doing this, so that I can work on trying to be calmer. But I don't know if
Okay.
I can initially just be calm, I guess, although
Okay.
that's the end goal.
Well, thank you for that. I appreciate it. And what will you be feeling instead of the fear, instead of the reaction? What would be in place of it?
I feel like uh, initially the fear will always come, and that'll be my like, you know, I guess the goal is to understand that, oh, or recognize that that's happening, because a lot of times it's like automatic and I don't even realize, that I'm then reacting.
Mm-hmm.
But just first recognizing, oh, I'm fearful right now, and that's, you know, uh, what's going on as far as how I'm about to respond now is from this fear place. So then what I like to feel instead at that point is just recognition that I'm fearful, just instead of just being fearful without any, recognition of what's going on. And then, yeah, again, like you said, ultimately that I would move into a place of calming down much quicker. Yeah, I guess it's kind of like a couple of things you could help me with is recognizing when I'm reacting from fear so that I know that that's happening, so I can help myself take more control of it. And then what can I do to then begin to calm down at that point when I recognize it?
Okay, after you recognize the, okay. And what difference would that make for you when you get to that point of recognizing it and calming down? What difference would it make?
It would make a huge difference with like how I interact with people, how I respond, so that I'm not, sometimes I feel like my fear response comes across, especially to my husband, as like it looks angry, but it's really coming from a place because I'm scared,
Uh,
but it's like
yeah.
that fear to be angry, that's scared. So I'm reacting in an angry way, and I don't want to treat my husband that way.
Right.
Um, the same with my daughter, that maybe it's like I'm like it's really a fearful place, but I'm reacting in anger. And so kind of, and I don't want to react like that to her. So kind of recognizing when I'm doing that, and that would, for me, that would mean, a huge change in uh, how I'm treating the people that I love the most, and really, treating them, in the way that I want to treat them all the time, as much as.
So your relationships and your family is very important to you, which is another connection with wanting to have more recognition in when you have a fear-based kind of response.
Yes.
Okay.
Yes.
Okay. So I'm going to ask a kind of a different question, but I know that you have a good imagination, so I think we can roll with it. So the question is, suppose when you go to sleep tonight, the rest of the day you do your normal routine, you get Lily to bed, you're watching TV, and then you finally brush your teeth, you're going to sleep, and you have a good night's sleep, right? It's refreshing, not too many interruptions in the night. And the imaginary part is that in the middle of the night, a miracle happens. And the miracle is this issue that you've been describing about fear-based response is gone. You don't have it anymore. It is completely gone. But you don't know that because you've been sleeping overnight. So when you wake up in the morning, that the problem is gone, the miracle has happened, but you don't know, what is the first small thing that you will recognize tomorrow morning that will tell you, oh my God, a miracle happened, and that problem of fear-based response is totally gone?
Huh. I don't know. I guess, I would feel maybe an overall sense of not dreading about my responses, because I think there's like a underlying kind of almost just my baseline is uh, just always operating from a place of just like, well, what if this happens? What if I do this? What, maybe that kind of feeling of just constantly this hot, this, anxiety, that's like an anxiety type feeling too, this fearful, this, I could, what if I act like this? What if this, what if I do this, would be gone. And so I'd be much calmer, I guess, as my baseline.
And so what would tell you, how would you know that it's gone or that you're calmer? What would be a small, tiny thing that would tell you, oh, it's gone?
Yeah. Like if my husband were to uh, tell me something that brought up fear, anxiety, I would be able to recognize it immediately.
Uh-huh. Uh-huh.
And that was what I was feeling, and my response at that moment would probably not be the best response because it's coming from a place of fear, and I would know that right away, so I could not respond, I guess, and then work on whatever skills you give me to calm down, and work on being calm.
Mm-hmm. And what else? Like, what would be happening in that time when you're recognizing it? Like, how, what would be happening if you're, oh, I'm recognizing it immediately?
I probably notice like uh in my body, like if I got tenser or something, I'd be like, oh, I noticed that my body's getting like tenser, or like I'm feeling like this. I always get this feeling that kind of rises up in my chest, like a, from the pit of your stomach. It's just like this icky feeling, I
Mhm,
noticed
mhm.
that feeling. Um, and and then I would know that physical sign, um, is that feeling I would immediately relate it to the fear response that if I respond right now, I'm going to respond from fear.
Mhm.
And so I would know that, right away, the moment he said whatever he said to
Right. Through the like the physical sort of
me,
reaction
physical.
would not be there as much, so to speak. Is
Well,
that
it would, and so
okay?
that way I would know that that it's happening, and
Ah, okay.
recognize it so that I know that if I respond, I'm going to respond from a fear-based place. But I mean, I guess ultimately, yeah, it'd be nice to like get rid of that feeling, but I just don't know if that's like, a possibility.
Mm-hmm, mm-hmm. So once the miracle happens, what do you think? And obviously, your family and your relationships are really important. Like, what else do you think that Seth would notice, your husband, that would be different about you, that he would know a miracle happened? Christina's different. This miracle happened. It's gone. What would he notice?
I think you would notice a big difference in the way that I uh react. So like the words that I choose to use,
Mm,
the probably just the tone of my voice. I think a lot of it's the tone of my voice. Um, and like the intensity of my voice would
mhm,
definitely change. My whole demeanor would probably look more relaxed and more curious than like you know
mm,
like fearful, and like what's this kind of like frustrated response, and it'd be more curious response.
yes,
uh, yeah, I think that he would definitely notice a big difference in
that's
that area.
awesome. Yeah, that's great. And these things are obviously difficult topics. That's great. You're coming up with these wonderful ideas. Can you think of a time in maybe the recent past or even in the past couple months where a tiny bit of that miracle happened, where you felt like you were more curious and you could feel that fear in your body and you could recognize it to kind of calm down a little bit quicker? Can you think about it? And just maybe a tiny bit, not a tiny bit of the miracle in the past, maybe couple of months.
Hmm. Yeah, I guess I can't think of like a specific time, but I feel like when I really, you know, am able to do more self-care, especially, I'm taking care of
Mm,
myself, so I'm in a better place. I'm able to then
mm,
more cognizant of the fact of how I'm responding, um, aware of what's going on, my feelings, and then yeah, work on controlling my response. So I feel like, you know, maybe I've done that a couple times, yeah, after I get a really good night's sleep and I've like maybe had some time to myself, I've been able to do it a little bit better. Yeah.
mm-hmm, mm-hmm, mm-hmm.
To respond better. Yeah.
Awesome. Okay, so the connection of
Yeah.
uh-huh.
Like, sorry, like just take space when I'm feeling fearful, not like, or not respond right away,
Okay.
and just like listen instead of like responding, because I know that I've been able to notice it, and that, and
Yeah.
if I responded, I knew that at that moment it wouldn't be helpful.
Okay. And that's something that you feel like you have done a little bit in the past, is wait
Yeah.
to respond, taking your time, doing some of the self-care that
Yeah.
you
Yeah.
okay. Okay. Um, That's great. Those are wonderful things. How did you make that happen? What did you do to make that happen?
I think I'm beginning to recognize how important self-care is, and so I try to really prioritize that when I can. Um, I try to remember that I do have more control than I guess consciously know, over my reactions. If I work
Mm-hmm.
on it, I know that I can begin to control it more. So I try to remember that. Um, and I guess that there are like things I can do, like just not respond right away. I
Yeah.
can stay curious, can ask myself, why am I feeling this?
Uh,
I guess, yeah, things like that.
okay. That's great. It's okay. Um, so is there anything else? What else about how you made that happen? Realizing that, it's really important for self-care is, what else? Can you tell me?
Self-care, the staying curious.
Okay.
uh,
And again, what else, how did you make those things happen? What else about how did you make it happen? What did you do? I mean, that's great. How did
well,
you do it?
to get to those places of understanding just those things that I can do.
Well, in the past, when
Mhm.
you've done a tiny bit of what you've mentioned about the miracle with
Yeah.
pausing, you feel like you have done that a little bit in the past, doing self-care. How those are great. How did you make it happen? What else about those things that you could make it
Well,
happen?
I guess it feels really good to feel in a place where I feel like I can be in more control of,
Yeah.
my fear-based responses, and that I have been able to control my response when I work on these things. So like just knowing that it actually works when I
Mhm.
actually practice these skills, like
Yeah.
actually take the time to self-care and take the time to
Yeah.
work on being, staying curious or just not responding, really consciously doing those things have worked. So I guess just knowing that they do work when I actually do them,
Right.
um, so it's encouraging.
Yes, that is really encouraging. That's awesome. So, what do you think it will take for it to happen again?
I guess just practice, but I guess where I get hung up is just just the remembering to do it, like when you're in a moment and things are really difficult and all your reasoning faculties, and
Mm-hmm.
like really, good thinking skills go out the window. And so I guess it's just like I really struggle with remembering to do these things.
Remembering. Okay. And I mean, I feel like that's normal. A lot of people have a lot going on in their lives, and it can be difficult. Um, can you think of like just a small, tiny step that could help you get to that self care, remembering more? What could be a practical kind of tiny, tiny step for you to take towards that?
Yeah, that's a really good thought. Um, and one that I tell all my clients too. I should put sticky notes up, so it's a visual
Okay.
something that I tell all my clients to do. I should do it too,
So you're
like
thinking like, okay, I tell my clients this. It's something that I should also. Okay, that's great. That's great. Yeah.
put it on my mirror, put it, where I can see it. Really, it's like front and center, like
Okay.
take a deep breath, or take space, or just, remain quiet, and then stay curious. I don't know, maybe those
Okay.
three would be
Well, let's
helpful.
say post-it notes. What do you
Yeah.
think it will take to incorporate post-it notes as a small step? What do you think it will take to make that happen? To do little post-it notes around the house?
Have post-it notes. I think, that's the first step, actually having
Well, I
them.
mean, like, what will it take to actually do the post-it notes? I guess you'd say.
I know. First step.
There's
Have the
tiny.
second,
Let's
right?
just
Right,
think
but
about.
guess just I'm gonna do it right after we talk because I feel like really
Okay.
motivated by the conversation,
Okay.
you know, like
Okay.
that, you asking me all these questions and reminding me what I want to do. It's really making me feel motivated to actually do it, So
Awesome.
I'm gonna say, I'm gonna do it after this and have that as my accountability that, I'm telling myself that after this, after I talk to Julia, I'm gonna do it.
Do it. Awesome. Well, we're over time, so I'm